Welcome to the Deep Dive, the show where we cut through the noise and get straight to the insights. Today we're diving into something that's really changing how we think about being well. It's the actual definition of health. For a long time, health was mostly seen as, well, just not being sick. If you didn't have a disease, you were considered healthy. Simple as that, right? But that whole conversation, it shifted a lot. Now we talk about overall well-being, physical, mental, social, the whole package. So think about it for a second. How do you define health? And that evolving idea is exactly what we're digging into today. We've got a really interesting recent study here, published in Psychology, Health and Medicine. It's titled Addressing Disparities, Unmet Health Needs and Its Impact on Health-Related Quality of Life. So our mission today is pretty clear. We want to understand how not getting the healthcare you need, maybe because of cost, maybe distance, lots of reasons, how that really hits your overall well-being. We'll be focusing on findings from Turkey, unpacking what these unmet needs actually look like on the ground, and how they connect directly to something called health-related quality of life, HRQoL for short. And crucially, what does this research suggest we could actually do about it? Okay, so let's start there. This term, health-related quality of life, it sounds maybe a bit academic. What are we really talking about here? It's definitely more than just, your physical condition. Remember that old WHO definition way back from 1948?
Oh, yeah, the classic one.
Right. Health is not only the absence of disease and infirmity, but also a state of physical, mental, and social well-being. HRQoL really builds on that foundation and tries to measure the quality part of your life, specifically as it relates to your health.
Exactly. And why HRQoL is so important now as a measure, it really pushes us past just counting diseases or hospital visits. It gets at the lived experience. How does a health condition actually affect someone's day-to-day life, their ability to move, to feel okay, to participate? So good healthcare policy, it shouldn't just be about treating the illness. It needs to improve people's actual quality of life. And when you improve HRQoL, you often see a better health outcomes down the line, definitely higher patient satisfaction. People just feel better, they engage more.
That wider lens makes so much sense. So if HRQoL is that overall picture of well-being tied to health, then the other side of the coin, the second big concept here, is unmet health needs. This is where things start to break down, right? The study defines it pretty bluntly as insufficient provision of health services, or just gaps between what's needed and what's actually provided.
Spot on. And it's not just asking, is there a hospital nearby? The real question is, are those services truly accessible? Are they equitable? Can everyone who needs them actually get them? And the study gives some really concrete examples of what these unmet needs are, things we see all the time, like the inability to actually pay for medical care. That's a huge one, obviously. Then there are delays getting appointments. Waiting weeks or months, especially when you need care sooner, that can be dangerous. Delays because of distance or just not having transportation. Maybe the clinic's there, but you literally can't get to it. And this one's tough. Not being able to afford the medications you're prescribed. You get the diagnosis, but the treatment itself is out of reach financially. All of these are major, major hurdles.
Absolutely. Real-world barriers. So tackling such a huge issue, how did the researchers measure all this? They used a pretty impressive data set, didn't they?
They really did. They drew on the Turkey Health Surveys, the THS, data from 2014, 2016, and 2019. And the sample size, even after cleaning it up, was massive. Over 70,000 people aged 18 and over. That gives you a lot of statistical power.
Wow. Yeah. That's a solid foundation.
Definitely. And to get at HRQoL within that huge data set, they were smart about it. They picked 15 specific questions from those surveys, questions that lined up really well with a standard globally used tool called the EQ-5D3L scale.
Ah, okay. So recognized measure.
Exactly. It looks at things like mobility, self-care, usual activities, pain or discomfort, anxiety or depression, key dimensions of quality of life. And importantly, they didn't just grab any questions. They tested them rigorously using factor analysis to make sure they were valid and reliably measuring what they intended to measure HRQoL.
Makes sense. So they had HRQoL measured. They knew the unmet needs. And what else did they look at? It sounds like they considered a lot of other factors too.
Oh, definitely. They cast a wide net. They looked at all the standard demographic stuff. Gender, age, education level, marital status, whether someone was employed, their income, social security status, and really importantly, they looked at the presence of cardiovascular diseases. And they considered all that alongside those 4 specific types of unmet needs we talked about: cost, appointment delays, distance, medication affordability.
We're trying to see how it all fits together.
Precisely, the interconnectedness of it all.
All right, so they crunched the numbers on over 70,000 people across several years. What did they find? I imagine it wasn't a simple picture.
No, definitely not simple. There were some maybe surprising positive notes, but also some really stark realities about disparities. One interesting thing up front. The overall average HRQoL score in Turkey actually nudged up slightly between 2014 and 2019.
Oh, really?
Yeah, it went from about 2.686 to 2.700. Now, this is on a scale where 1 is the worst possible quality of life and 3 is the best, so a small improvement overall.
Okay, a slight positive trend.
But, and this is the absolute core finding, that slight overall bump hides a much bigger issue. The study found very clearly that unmet health needs significantly reduce HRQoL. It wasn't even close. People who couldn't get the care they needed, whether because of money or waiting lists or transportation, they consistently scored much, much lower on quality of life. This isn't just a minor inconvenience we're talking about. It's a deep impact on their daily functioning, their well-being, how they feel about their life.
Okay, so that link is clear. Unmet needs drag down quality of life. But digging deeper, who was hit hardest? Did the study identify specific groups who were more vulnerable?
Absolutely. And this is where it gets really interesting because many of these patterns aren't unique to Turkey. We see similar things in research all over the world. For example, women. Consistently, across all the survey years, women reported lower HRQoL scores compared to men.
Huh. Is that common elsewhere too?
Yes, very much so. Studies in places like Brazil, Japan, Korea have found similar gender disparities. And another recent study in Turkey actually found women there faced more cost-related unmet needs specifically. So there are layers to it.
Okay, what other groups stood out?
Older individuals. HRQoL tended to decrease as people got older, especially for those 65 and up.
That seems intuitive, maybe. More health issues as we age.
That's likely a big part of it. More chronic diseases, maybe reduced mobility, more pain. All things that directly impact your daily life and how you feel. Then there was a really strong connection with socioeconomic status. Lower education levels and lower income were directly linked to significantly lower HRQoL. And conversely, as education and income went up, HRQoL generally improved. Again, this echoes findings from China, India, many other places. Socioeconomic factors are just fundamental to health access and well-being.
Makes sense. Any others?
Yes. Unemployed individuals also generally reported lower quality of life. That ties into financial security, of course, but also the psychosocial aspects of work and identity. And finally, divorced and widowed individuals consistently showed lower HRQoL compared to married or single people. Those major life transitions often bring huge emotional stress, social changes, sometimes financial strain, all impacting well-being.
Wow. So it's not just one thing. It's like these factors pile up, don't they?
Yeah.
An older woman, maybe unemployed, lower income, the barriers just multiply.
Exactly. It's the intersectionality of these factors that creates really complex challenges for people trying to navigate the healthcare system and just live a decent quality life.
Now, the study paid special attention to cardiovascular diseases, CVDs, things like heart attacks, coronary heart disease, stroke, hypertension. Why the focus there, specifically in Turkey?
That's a critical piece. According to Turkey's own statistical institute, CVDs are actually among the leading causes of death in the country. So they have a massive public health impact.
Okay, so a major health issue for the population.
A huge one. Understanding how CVDs affect quality of life, and especially how unmet needs play into that for people with these conditions, that's vital information for policymakers. And the study found a very direct link. People with any kind of cardiovascular disease had lower HRQoL, period. But get this, if they had CVD plus another chronic condition, what doctors call comorbidity, their HRQoL was even lower. It's a compounding effect.
Right, the burden just gets heavier. So how did those specific unmet needs, the cost, the delays, the transport, how did they directly impact people with CVDs? Could you see the effect in the data?
Oh, absolutely. The impact was clear and measurable for each type of barrier. Let's break those down. First, financial difficulties, being unable to afford care. This was a big issue. In 2014, about 15% of people reported this. Thankfully, that number dropped to around 9% by 2019.
Yeah, some improvement there.
Some improvement, yes. But for those who did face cost barriers, their HRQoL scores were significantly lower. If you can't pay, it hits your well-being hard, especially with something ongoing like CVD. Then, delays due to appointments. This one actually showed a worrying trend. It affected about 21% in 2014, dipped a bit in 2016, but then jumped up to almost 26% in 2019.
Wow, it got worse.
It did, according to this data, and those long waits were clearly associated with lower HRQoL. Imagine having a heart condition and facing months of delay for a checkup or test. It's stressful and potentially dangerous, points to maybe systemic capacity issues.
Definitely. What about getting to the appointment?
Right, delays due to distance or transportation. This affected around 10 to 14% of people across the years. And again, if you couldn't easily get to your doctor or clinic, your reported HRQoL was lower. Geography and infrastructure matter. And lastly, inability to afford prescribed medications. About 11–12% faced this in 2014, dropping to around 6% by 2019. Still, for those affected, not being able to afford the meds they need significantly lowered their quality of life. The treatment plan breaks down right there.
Yeah. So, you see, each barrier, money, waiting times, travel, medication costs, they all add up. They make managing a chronic condition like CVD much harder and directly diminish people's quality of life. It's like a cascade.
That paints a really clear and frankly concerning picture. So the big question then, what do we do about it? What does the study suggest as concrete steps forward? Maybe not just for Turkey, but potentially lessons for elsewhere too.
Yeah, the study doesn't just point out the problems. It offers a pretty robust set of recommendations, and they really emphasize a holistic, multi-level approach. It's not just one magic bullet.
Okay, what are some key areas?
Well, first off, policy and financial adjustments. This is huge. They suggest things like reviewing the co-payments people make under universal health insurance, maybe tying them more closely to income level, and expanding social assistance programs specifically for those with lower incomes, lower education, and also those with CVDs who clearly struggle more.
It's basically saying economic policy is health policy.
Right, addressing the cost barrier head on.
Exactly. Second, they really push for education and health literacy. Helping people understand their health better, make more informed choices. That's key. This includes general health education, but also targeted stuff, like vocational training or specific health awareness programs for groups with lower education, aiming to empower them.
So knowledge is a tool.
Definitely.
Yeah.
Third, a big focus on proactive wellness and support, like encouraging wellness programs in workplaces, especially for desk jobs, to try and prevent things like CVDs in the first place. Also, expanding support services for vulnerable groups, the elderly, people with chronic conditions, making sure they have the specific help they need. And crucially, developing more mental health awareness and support, especially for people going through big life changes like divorce or widowhood, recognizing that impact on HRQoL.
Addressing the whole person, not just the physical symptoms.
Precisely. Fourth, they call for basic, systemic, and infrastructural improvements. Things like making digital health services more common for routine care, which can overcome distance and maybe some delays. And, practical things. Improving public transport, maybe even setting up better patient transport systems so people can actually get to their appointments.
Yeah, the logistical side.
It matters. And finally, a strong emphasis on disease prevention. Public campaigns focused on preventing and catching cardiovascular diseases early. If you reduce the number of people getting CVDs, you automatically improve HRQoL overall.
That's a really comprehensive list. It really drives home that improving quality of life isn't just about doctors and hospitals. It's about finance, education, infrastructure, social support, everything.
It truly is. It requires looking at the whole system, the whole society, and how it supports or hinders individual well-being.
So, wrapping up our deep dive today, the main message seems clear. Health-related quality of life is this rich, complex idea that goes way beyond just not being sick. It's deeply tied to whether people can actually access the care they need, when they need it. It's about physical, mental, and social well-being all intertwined.
Absolutely. And really understanding these gaps, these disparities that the study highlights, that's the essential first step. It's how we start building healthcare systems that are not just effective, but genuinely equitable and focused on improving people's lived experiences. There's always more to learn, of course, and listening to different perspectives, especially from those facing these barriers, is critical for finding solutions that actually work.
Definitely. And this study really hammered home how things like transportation or ability to pay directly impact well-being. And that's me thinking, what connections might exist right here in your own community? Connections between things we might not normally link directly to health, like the quality of public parks or access to safe housing, maybe even reliable internet access, and the overall health and quality of life for everyone around you. It's something to ponder. How do those broader investments we make as a society ripple outwards, affecting individual health in ways we might not always expect?